Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, DrAndyRoark. Guys, I got a good one for you today. I am talking to Dr. Simone Guerios about her recent article on the impact of the COVID-19 pandemic on spay-neuter surgeries and on pet overpopulation. I was really I was shocked by the impact of this. It totally makes sense that we would see shelters and spay-neuter facilities shut down for the pandemic, and then there be those animals who didn't get spayed or neutered. I guess my thought had always been that they would be reabsorbed, but that has not been the case. And now we're seeing not just the pets that didn't get done during the pandemic, we're seeing the progeny, the litters from the pets that didn't get done during the pandemic. And it is, it's shocking. It is a fascinating and unsettling reality in our profession. So I was really interested to dig in with Simone on this and talk about it. Guys, a lot of food for thought here. I hope it's interesting to you. I definitely enjoyed the conversation. Let's get into this episode.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast, Dr. Simone Guerios. Thank you for being here.
Thank you, Andy.
Oh, it's my pleasure to have you here. You are, for those who don't know you, you are a clinical assistant professor in shelter medicine at the University of Florida. I did not have the pleasure of having you as my shelter professor at University of Florida, although I took that rotation multiple times because I loved it. I really, really loved it. And so I did not get to have you as a professor. I became aware of you when I saw a publication you were first author on that came out. I'll put a link down in the show notes. But basically, you were talking about a significant setback to our goals of a population control for stray pets due to COVID pandemic. And so I wanted to understand that math and kind of what that looks like today with you. And so if we could start off, can you paint me a picture of kind of what spay-neuter efforts look like before the pandemic? How were we doing? How were we doing before the pandemic? What was that like? And then we'll talk about how the pandemic changed things.
Okay, so we've been doing a very good job, animal welfare plus shelter veterinarians, for almost 50 years that we've been working to reduce or to control pet overpopulation. And the most thing that we have been able to do is spay-neuter. So we start doing a good program, and that ultimately reduce number of animals that have been euthanized in shelters. So we've been doing a very good number all over US. And our study, since we have COVID pandemic that it blocked almost no essential services for almost 4 to 5 months. We want to see what happened with spay-neuter programs since they were considered as no essential. So mainly our goal to this paper was to show what happened with spay-neuter surgery during this pandemic, so 2020 and 2021. And we compare with 2019, that was a normal year, a regular year.
Okay. So when you start off, so you looked at 2019 numbers to get started, and then non-essential services shut down, and then you said what about basically like 5 months of having a significant reduction in the services we were able to offer, correct?
Yes. Mm-hmm.
All right, cool. So tell me, let's talk about point of impact. So yeah, walk me through what that meant. Like how do you measure that? How do we try to get our head around what you saw in your survey, but then how that extrapolates out across the US? Help me understand the magnitude of what we're talking about.
So we use a software-based program that is made basically for high volume spay-neuter clinics, and in their software, we were able to use 400 clinics that normally use this program as their regular clinics program.
Okay.
So from this 400, we had to use the clinics that were in service for 2019, 2020, and 2021. So our numbers represent around 212 clinics. And with that, we saw for 2020 a decrease in 13% of surgeries, the total number of surgeries. And 2021, we saw a still 3% less surgery when we compare with 2019, the baseline year.
So significant dip in 2020. What does that translate to as far as, so two questions in my mind at the same time. When we decrease 13%, what does that look like in those clinics? And then what does that look like when we extrapolate out? So you're talking about 212 clinics, which is a lot of clinics, but it's a drop in the bucket compared to the number of total clinics out there that are doing spay and neuter. So help me understand that. So what does that look like as far as in these clinics, a 13% reduction? Give me a number. What does that look like? And then help me extrapolate this. How big is that nationally?
So so numbers kind of, we extrapolate for the national about 2.7 million of spay-neuter surgeries for the whole deficit that we might have. So our numbers got around 198,000 fewer surgeries in 2020. So that's basically we are still low in 2021, but basically we're the month on March until June, July that we can see a very big drop in surgeries because we weren't allowed to perform surgery. Okay.
Has there been an overcompensation, or not an overcompensation, but has there been a compensation since we come back, or is there? So if we were, down 3% in 2021, are we at where we were in 2019? Are we over? Because if you said we're 20% more than we were in 2019 now, I would say, well, maybe that's a good thing. Maybe we're catching back up. Well, help me think about that. So as we look forward into where we are today, extrapolate that out. Is there a sense that we're still in a deficit? Do you feel like we've returned to 2019 levels? Are we exceeding 2019 levels to help make up for missed opportunities at that time? What's your optimism level like?
I believe we are at the same kind of level of 2019, but we still have this big gap that I don't know how we are going to fill that up. So because now we have shortage of veterinarians and shortage of vet technicians, so everybody's over crowded. It's hard to book spay-neuter surgery in a low-cost clinic. And what we've been at the shelters, we are also at this point we are overcrowded. So what we saw this past year is that we are looking at many the litters of puppies that we weren't being able to see it before COVID. So we have many puppies entering the shelter. No, the rescues are also overcrowded, so nobody's pulling them. We also saw overcrowded shelters because people start to work back and they are bringing animals back to shelters. And unfortunately, we are worried that shelters are going to start euthanizing for space again, which is very unfortunate. So I believe we are at the same level at surgeries at this point, but for us to go up to almost 16%, because we have 13 in 2020 and 3% less in 2021. So we need to overlap that. So we need to pay more attention and try to increase fundings and resources so the clinics can actually try to catch up with all the work we have been doing for the past almost 50 years.
Well, as I think about this, if we have a glut of pets from 2020 that would have been spayed or neutered and are not, those pets are now 2 years old, which is probably maximal breeding output levels that we're going to see from those pets. And so what you're saying is, do you feel like the progeny of those pets that were missed are hitting? So it's not just we didn't neuter a cat 2 years ago, and so now there's an unneutered cat out there. It's like, oh no, we didn't neuter a cat, and now we're getting 2 to 3 litters per year from this cat, which is exponentially impacting our capacity. Talk to me a little bit about catching up, because this is a thing that I'm really interested in, is labor shortage, the shortage of veterinarian, things like that. What are the levers that we pull to try to get out of this program. And you're a professor, of shelter medicine. So, are there efficiencies that we see coming in shelter medicine, or that we could be using in shelter medicine? How do we get out of this hole, Simone?
That's a great question, and I don't know if I can have a solution with that. But I think the best way for us to work with. So at University of Florida, we are trying to make our students to get out of school ready for being able to work in a high volume surgery situation. So we kind of open another clerkship. So we have 3 shelter medicines clerkship at University of Florida that they used to get out of the school with 1 or 2 space per student. And after one of 2 of these clerkships that they are mandatory now, they are able to be done at least 25 to 30 surgeries during 2 weeks. So we are trying to capacitate more students so they feel ready when they get out of the school, so they can join a shelter or a non-profit organization, and they are able to help. However, I think we need more grants and money to work with numbers for sterilization animals, for dogs and cats to be spayed and neutered, so we can try to catch up with that.
Hey everybody, just want to jump in real quick and give you a heads up that the April Uncharted Veterinary Conference is coming at you. This is the flagship, the granddaddy, the mama of them all. This is our original conference. It is here in my hometown, Greenville, South Carolina. Guys, this is a communication business strategy conference. We are doing all internal communication and strategy this year. It's about talking to your team, getting them on the same page, making sure messages don't get dropped, making sure we're communicating well, we're treating each other well, making sure that we are on the same page and not repeating work or having people stand around and not know what to do with themselves. That's what this conference is all about. Guys, this is a peer conference. We do our choose your own adventure sessions. We make up about 40% of the agenda of the conference here on the spot with our attendees, so we can make sure we're doing what they want to do. It is really a magical experience. If you've never been to an Uncharted conference, this is a great one to jump into. I'll put a link in the show notes. Get registered, come to Greenville. I'll see you in person. Guys, let's get back into this episode. When you think about the future of shelter medicine, do you see it traditionally, when we talked about spay and neuter efforts, a lot of that weight was carried by general practitioners, and they would do spays and neuters and things like that. And I've really kind of fallen in love with this idea that the future is fragmentation, meaning there's going to be a lot of different ways of practicing medicine, and they're just different. And do you see, I guess coming around to my question, do you see spay and neuter surgeries, things like that, being standing alone more, or do you continue to see them being integrated into types of wellness practice, general practice, things like that? When you're training students to talking about the future of shelter, what does that look like in your eyes?
So I think everybody needs to work together. I don't want to say, okay, spay-neuter needs to be done only by shelter veterinarians or high volume clinics. I think it's very important for general practitioner also to increase the number of surgeries that they can also help to reduce the number of unwanted pets. And I know there are many of a discussion about aging and when should I spay my animals. And this is very important for general practitioners to, okay, can we spay this animal sooner than later because of tumors or anything that is happening, because this is a big issue at this point. But I think it's important for us to work together, because you never know when your pet's going to end or what's going to happen with you if you didn't spay your pet, and then something happened in your life and your animal ends in the shelter or somewhere else and start having litters. So I think it's very important for us to work with general practitioners together to try to spay and neuter everything that's not supposed to be reproducing. Yeah. So if the goal is not to have litters, so it's better to get it done. And I don't know the other part of her question, was it? I think I lost in the middle of
Yeah, no. I was just sort of thinking about the how do you see shelter medicine being practiced sort of going forward? Is it the low cost, high volume practices? Is it integration across different types of practices? I think you answered it. I think you answered it pretty well.
And also increasing the number of low cost clinics. That's very important because general practitioners also need, I think they should work with animals, helping them in different ways. So if I have a chronic condition or if I have any other issues, that's the way they can help more than just doing other simple procedures. Yeah. So I think we have to work all together to get almost all the animals that we don't want them to reproduce, and then they can work more with other disease that affect pets. I always tell my students, because during the clerkship, my students I have like 20% or less that wants to go to shelter medicine, to work with shelter medicine after they graduate. But I tell them that's very important for them, not only the surgical experience, but it's very important for them to learn what happened in a shelter, because you probably see an animal that was adopted from a shelter or rescue. So you can see how things are done differently. And you, instead of being against the shelter veterinarian, support and work with us, which is very important for them. So this clerkships also help them to get more hands-on surgical experience, but also, okay, why we did a vaccine at this age and not at that age, because it's a shelter medicine. They might not be able to do a rabies vaccine never again. So it's better to get it at 12 weeks instead of 16. So it's very important for them to see what's happening, because it's good that people are adopting more than before. So you'll probably see and treat animals that were adopted or came from a shelter.
You said something earlier I want to circle back to a little bit. So as veterinarians have been more open to discussing with pet owners health benefits of delaying spaying and neutering, do you feel like you're seeing an increase in litters associated with those types of behaviors? Do you think that, because I've always wondered that there's always a trade-off. There's always a trade-off of if we do it earlier, we're learning there's health impacts to that. But if we do it later, we're also risking having unwanted litters, things like that. Have you seen any sort of research to back up that correlation, or anecdotally, do you feel that impact?
Yes. So there are many research that show some cancer associated with early spay-neuter, but the numbers are not, and also some orthopedics in large breed dogs, but the numbers are not as reliable. So the big numbers that we see is that the animals are spayed or neutered, they will live longer. So I still think it's more beneficial for the animals to be spayed earlier than later if you are not interested in having puppies or kittens. So another important thing is, for one of the most disease that we see in animals that are not spayed are mammary tumors. In Brazil, since I'm from Brazil, we don't have the same culture of sterilizing animals earlier in life. And 80% of my patients were mammary tumors.
Oh, wow.
So then you have to, because they wait for a year and then they will spay 1 or 2 heats and then they will spay it. And we see so many mammary tumors. And sometimes they don't progress badly, but sometimes they do. So if you do it earlier, you won't have this problem. So also other hormone-related disease, these are the most important, the pyometras and other stuff that you can actually save their lives or make them healthier. And if you think the percentage of cancer that will show up in an animal that wasn't or that was spayed is not as relevant as if you compare with hormone-related disease. So overall, of course, you have to think about each breed and each animal and how the owner, the owner is. If it's a person that will follow up with the animal and then will bring later on, like 1 year or 2 years for spay or neuter, you have education. So it's very important. You have to educate your clients, and I think education is the gold standard. You cannot just do a spay-neuter program and do not educate whoever is adopting or owners or community.
When we circle back around to talking about the COVID pandemic and the pause in sterilizations and things like that, do you think pet owners have any idea? Are you seeing initiatives, pet owner facing initiatives or messaging to help raise awareness of the fact that this is going on?
I don't believe pet owners do have, but I know animal welfare is trying to show the public and everybody that we are in the backlog with surgeries and with the overcrowding in shelters and so many puppies and kittens getting into the shelter. They are trying to advertise that we need to have more conscious and work into that gap that we had.
What would you like to see veterinarians do? So as we talk about action steps, I always like to leave on a positive note and sort of say, what are the steps that veterinarians can take that would be beneficial?
I think educating their owners to sterilize their animals earlier and more often, so it can work. And if you don't have the money for the surgery, you can also refer to a low-cost clinic. Just they can get it done. So I think the main issue is the low income customers, that they are not, sometimes, especially with all this COVID, sometimes they cannot afford surgery. So try to work with educating them the importance and to get it done. So I think that will be a way to go.
No, I appreciate it. I think that's good insight. Is there, are there any resources that you really like? If someone's listening and they think, I'd really like to learn more about this, I linked to your original article and the publication that you put out in the show notes, so people should definitely check that out. But just, do you have general favorite recommendations? If someone said, I'm interested in shelter medicine, I'm interested in population control, where would you get people started?
You're talking about veterinarians or
sure?
regular?
Well, actually, if either one, but mostly veterinarians is what I look for.
I would recommend for them to look for their local shelter. In our community, have many shelters that do not have a veterinarian on board. So sometimes they do have the facility and everything, but they do not have a veterinarian. So try to work with them as a relief veterinarian, or maybe you can start volunteering. I know volunteer after you graduate sometimes not the best.
No, it's good. I feel like people get stuck in a rut, and a lot of people are interested in doing different things in what they do. I think I love it. I'm a huge fan of volunteering in different areas in medicine, and use your skills differently, shake things up, try things different from what you do. I think it's good for your soul.
Yes, I agree. I agree. So I would recommend for you to reach out to local shelters and see how they are at this point, and go from there. Of course, the University of Florida is always open to any questions, and just we have a great shelter medicine team.
You have an amazing shelter medicine team. I'm sorry, Julie Levy's there, and
Dr. Crawford.
Cindy Crawford is so great. She I'll never forget that when I applied to vet school, Cindy Crawford was one of the person who interviewed me, and she was so nice and reassuring. I've just been a fan of hers for the rest of my life since then. I've been a fan of hers, but you have such a wonderful group. Yeah,
they are amazing. And we have, now that we have 3 clerkships, so we have the Alachua County Animal Services, that is when I'm working now here in Gainesville. Then we have Miami-Dade Animal Services. If you have the opportunity to go visit that shelter, is one of the best shelters in the U.S. It's amazing. And VCOP, the veterinary outreach program, probably was there when you start studying in Florida. I don't know if you had the opportunity to enroll to that clerkship.
I did not. It was not there. I think it came in shortly after I left.
Okay. So we have these three like hands-on clerkships. So the students can really get hands-on and they learn everything since primary, basic, vaccines and everything. They visit shelters and also they do spay-neuter surgeries, more like a shelter veterinarian, like a high volume. So not like surgery at UF that you do a laparotomy, like exploratory laparotomy incision size. So they learn how to do it efficiently and accurate, like safe. Other procedures like amputations, enucleations, everything that in a daily base in a shelter needs to help more pets to get adopted. So they will have all this experience. And then they also have the online shelter certification that they can go, which can also be done by professionals. So if you're a veterinarian and you want to start shelter medicine, you can do the online certification, which is good. When I started here in the US, I was a soft tissue surgeon and I didn't have as many opportunity to do shelter medicine in Brazil because we do not have, now we do, but 5 years ago, we didn't have really real shelters. So I went through the certification and you can learn a lot from the classes and everything. It's very good. So I recommend.
Well, I will put links in the show notes for that so people can check it out. I will link to the UF shelter program just because it's a great program and everybody should see it and be aware of it. Simone, thank you so much for being here. Guys, thanks for tuning in and listening. I hope this was interesting and helpful. Gang, take care of yourselves.
Thank you.
And that is our episode. Guys, I hope you enjoyed it. I hope you got something out of it. Thanks to Simone for being here. Gang, if you enjoyed the podcast, if you got something out of it, leave me an honest review. Wherever you get your podcasts. Apple Podcast is a big place that a lot of people find it. Same thing on Spotify, things like that. But anything that you can do to spread the word is super duper appreciated. It's how people find us. And I just love being able to share stuff like this with the world and just get the word out and just get people thinking. It just means a lot to me. Anyway, gang, take care of yourselves. Be well. I'll talk to you soon.